I am preparing an IM injection for a baby. So I'm going to start this by washing my hands. I have an MAR with an order from the doctor here, so I'm going to gather my supplies, get the medication out. I would unlock the medication cart, and I have my information here. I'm looking for hepatitis B vaccine. Okay, so I'm going to take it out and compare it. I'm going to check that it's the right patient, Allison Alvarez. I'm going to check its right medication, hepatitis B. The dose is 0.5 milliliters. It's not expired. It's an intramuscular injection. In order, I have consent from the parents. So I'm just checking everything off. I'm going to get my supplies. I need to get the needle. Let's see. I need a 27 gauge half-inch needle. Okay, so I have this needle, I have my medication, checked everything out, everything matches. I'm going to lock this up and I'm going to go prepare the medication to administer. Okay, I'm at my workstation. I'm going to prepare the vaccination that I'm going to administer. So I already gathered my supplies and the medication, and I'm going to check it again. Right patient, Allison Alvarez. Right med, it's the hepatitis B vaccine. Right route is intramuscular. The right time, it's now. It's an open order from the doctor, so I have that. The reason is vaccination. I have signed consent from the parents, and everything matches again. I checked it, so I'm going to go ahead and draw this up. I have my 27 gauge needle. It has a syringe with a half-inch needle. I'm going to just clean the top of the vial here, ampule. I need a 0.5 milliliter, so I'm going to draw that amount of air up, and then I'll eject it in. I drew up the medication. I'm going to just check it one more time. Patient, Allison Alvarez, hepatitis B, 0.5 milliliters, intramuscular injection. Vaccination is the reason, and it's an open order to be given now, so everything's all set. I would put the medication away, lock the cart, and I'm ready to go administer it to the patient. Okay, so now I'm ready to administer the vaccination to the baby. So I'm going to come into the patient's room. I would knock. I'm going to identify myself. My name is Sharon. I'm a student nurse with HCC. I would be speaking to the parents. I would tell them I'm here with the hepatitis B vaccine, which we already have the signed consent, so that's all set. I would ask them if they would like to be present while I give the injection so they can comfort the baby, anything like that. I'm going to double check again, checking the baby's band, the parents' band, make sure everybody has the right name, Allison Alvarez, and I would have them verify the full name and date of birth. 1/1/13 is the date of birth. It's the right medication. I have the hepatitis B vaccine, 0.5 milliliters. The route will be intramuscular. The reason will be vaccination from hepatitis B. I have the open order from the doctor and the signed consent. So all my rights are checked out. Everything is ready to go. I would open up the baby stuff and put my gloves on. I'm going to undress the baby, at least from the waist up, and open the diaper so that I can visualize where I need to give the injection.
And that is equals 1.2 milliliters given. I checked my expiration date, which is 2/20.
I could also cover the baby with a little towel or a cloth just to make sure, for privacy, or even to make sure that the baby doesn't urinate. Well, if the baby urinates, at least there'll be something there. So I'm looking at the baby's leg. I'm going to use the right leg for this injection. And I'm going to visualize the thigh in thirds, and I know I'm going for the middle part and the vastus lateralis. So I just will find the spot that I need and clean it with alcohol. Okay. Let it dry for a moment. I would grasp the baby's leg, stabilizing the knee and the thigh. I'm not going to inject into this baby, but I would inject in, aspirate a small amount just to make sure there's no blood return. There's not, so then I will inject the medication. I'll remove the needle and cover it with a little bit of pressure with the alcohol swab. Not massaging, just holding it here. I'll watch the baby to make sure there's no type of reaction. I'll document the whole procedure, wash my hands, remove my gloves, and throw them out.